This segment of Delmarva Life is brought to you by the Veterinary Medical Center in Easton.
You know, most pet owners do what they can to ensure their companions are healthy. That includes making sure they get annual physical exams.
And paramount to the overall health of your pet is dental care. Nobody knows that better than the two with us this afternoon. This is Dr. Elizabeth Bruce and this is Dr. Caitlin Hutchison, both of Veterinary Medical Center in Easton. Thank you so much for joining us this afternoon.
Thanks for having me.
And you brought Lydia along.
And Lydia.
Yeah.
Wouldn't be a show without her.
I know, right?
Okay, so dental health. Why is that important?
Well, lots of reasons. In small animal world, it's just like people. The health of your mouth is important, and it not only reflects your overall health, but it can contribute to serious issues: cardiac disease, chronic inflammation, pain. It's, you know, uncomfortable, and it's also not fun if your pet's got horrible breath.
Bad
you
breath.
don't want them around your face, so you know, keeping that taken care of certainly helps keep them live longer.
Makes sense.
And just as much in equine as
yes,
well.
just as much as in horses as small animals. And you know, most people are riding their horses, so you also have the added, you know, part of having a piece of metal in their mouth. So you know, it's very important to take care of your horse's teeth as well.
So is there anything we can look for to indicate there may be some dental problems?
Yes, absolutely. In horses, it's a little bit different than dogs. Horses, if they are dropping feed or like quitting their feed, which means they're making balls and then dropping it, if they're throwing their head when they're riding, if you smell a foul odor, anything like that, or if they're dropping a lot of weight and you don't really know why, those would be reasons to have your teeth checked.
What about in our companion pets, dogs and cats?
You know, sometimes we don't even notice that there's a problem because it's so gradual. And, you know, unless it's real serious, so they can actually stop eating, which is really actually quite unusual. Most often people might notice they're not playing with toys or they're chewing kind of funny, like one side of their mouth, or that one side of the mouth has got a lot of tartar and the other side doesn't. So they're probably always chewing on that side. But a lot of times we don't notice symptoms, but people do notice bad breath. That's probably the biggest.
So what happens if we leave it untreated?
Well, the periodontal disease develops, and that's the structure that supports the teeth that becomes really not supportive anymore. So the teeth become loose, it's painful, they can be broken teeth, and it's a slow kind of chronic process, so our patients can often be uncomfortable for months to years with this.
And they don't tell you.
They don't tell you.
And veterinary dentistry is a thing. It's important that you see.
It is. There's actual specialty for veterinary dentistry, just like with, you know, your dentist is a specialist.
Very interesting. All right. Now, a lot of times you use some kind of anesthesia or sedation when it comes out. For equine, for horses, it's sedation?
Yes, we sedate them instead of generally anesthetize them like they do in small animals. This allows us to place a speculum in their mouth. So it's a piece of metal that helps to hold their mouth open, so we're able to see the entire dental arcade all the way to the back of the mouth. So we're able to evaluate every tooth and every surface on every tooth, as well as the gums. Sometimes they'll get really sharp points that will cut the buccal surfaces and make some really nasty ulcers and make them really uncomfortable. So sedation allows us to really have a good look in there and evaluate everything.
And for the smaller pets, you put them under when you clean their teeth for the most part?
For the same reason. We'd use anesthesia because we're usually combining that with a dental cleaning, which is a scaling and polishing. So there's a lot of water and stuff floating around, and you have to have the pets open, their mouth open, and there's no way to really do that procedure and protect their airway. You know, we don't want them inhaling all that water. So we generally have them under general anesthesia. That way we can get dental radiographs, because we always, at our practice, we always radiograph every mouth when we do a teeth cleaning. We do an oral exam where you can inspect or look at every corner of every tooth, because a lot of times there's problems that you just can't see. So, yeah.
All right.
Dr. Elizabeth Bruce and Dr. Caitlin Hutchison from the Veterinary Medical Center in Easton. Thank you so much.
Thank you for calming down.
Yeah.
We're right there on the ragged edge the entire interview. Thank you so much,
Thank
Dr.
you.